How are recovery milestones measured in osteosarcoma clinical trials? Have you ever wondered how doctors track recovery in patients with osteosarcoma during clinical trials? This process involves several important steps that help measure how well a patient is responding to treatment. Osteosarcoma is a type of bone cancer, and understanding recovery milestones is crucial for effective management. One of the first ways to measure recovery is through tumor response evaluation. Doctors use imaging studies like X-rays, computed tomography scans, magnetic resonance imaging, and positron emission tomography scans. These tests help assess changes in tumor size and characteristics. A reduction in tumor size or stabilization without further growth is a significant milestone. To quantify this response, radiological criteria, such as the response evaluation criteria in solid tumors, are often applied. Another key milestone is the histological response. After patients receive neoadjuvant chemotherapy, which is treatment given before surgery, the tumor that is surgically removed is examined under a microscope. Doctors look for the percentage of tumor cell death, known as necrosis. A high degree of necrosis, usually over 90%, is linked to a better prognosis and is an important indicator of treatment success. Surgical outcomes also play a vital role in measuring recovery. A successful complete surgical removal of the tumor, ensuring clear margins where no cancer cells are present, indicates effective local control of the disease. This is a major milestone in the recovery process. Functional recovery is another critical aspect. After surgery, assessing limb function and mobility is essential, especially if limb-sparing procedures were performed. Doctors use functional scores and patient-reported outcomes to evaluate how well patients can move and perform daily activities. Longer-term milestones include disease-free survival and overall survival. Disease-free survival measures how long a patient remains free from cancer recurrence, while overall survival tracks the total time a patient lives after diagnosis. These are primary endpoints in many clinical trials for osteosarcoma. Quality of life measures are increasingly important in these trials as well. Patient-reported outcomes regarding pain, fatigue, emotional well-being, and daily functioning provide insights into how treatment affects a patient's overall life experience. Lastly, biomarker and laboratory assessments may be conducted to monitor blood tests and molecular markers. These help detect minimal residual disease or early signs of relapse, although they are often more investigational. In summary, measuring recovery milestones in osteosarcoma clinical trials involves a combination of tumor response, surgical success, functional recovery, survival outcomes, and quality of life metrics. These comprehensive measures allow healthcare providers to understand how well a patient is recovering and responding to treatment. Clinical trials follow standardized protocols to ensure these milestones are consistently assessed, guiding future treatment strategies. Always consult healthcare professionals for personalized advice and treatment plans.